So let's go ahead and finish up the information here on the lower extremity, our lower extremity. So we're going to talk about the muscles that move the hip joint. Now, in case you're not really quite sure what that joint is, that's going to be where the femur is going to join the os coxa. They call that joint the femoral acetabular joint. So that means we're going to discuss the muscles that are found in the thigh. The thigh is the portion of your lower extremity that is found from your hip down to the knee. And we talked about this last week, in which we were discussing how in your arm you had different compartments. Well, similarly, right, in the thigh, right, we have our muscles are going to be organized into 4 compartments. The anterior will be the front compartment, the posterior will be the back compartment, and then you have the muscles on the inside of your thigh, that'll be the medial compartment, and then the muscles on the outside of your thigh, that'll be the lateral compartment. And here we're going to talk about how, all right, these compartments were separated by that deep fascia. All right, so again, this is important if you're going to get in. I mean, it's important, but I mean, you should know this, especially if you're going to get into sports medicine, because you'll see people that play contact sports and even emergency medicine. You should know these compartments, because if you suffer a trauma to these tissues and these compartments, you can get, especially if it's the type where there's a lot of swelling and or bleeding, right, that will start to fill that compartment up and compress those tissues in there. So when we're talking about the anterior compartment, those are going to be the muscles that are on the front of your thigh, and so they are going to extend the knee. What does that mean? They're going to straighten your leg, okay? And they're going to flex the thigh. Well, what does that mean? If I ask you to bring your knee to your chest, you are flexing your thigh. The medial compartment, real easy, they're on the inside, so they're going to adduct the thigh. What is that? Well, if you are doing a stretch in which you're bringing your leg away from your body, when you bring it back towards the ground or towards your other leg, that's adduction. The lateral compartment will abduct. So if I say bring your foot as far away from your body out to the side as you can, that is abduction of the thigh. And the posterior compartment muscles, these are on the back, they're going to flex the knee. Dr. Kaz, what is that? That's bending your knee. And then they're going to extend the thigh. That is going to be bringing your leg as far back as possible. Like if you were going to kick a soccer ball, right, and you want to get as much power into kicking that soccer ball, you're going to bring your leg as far back first and then bring it forward to kick. So when you're bringing it backwards, that's extension of the thigh. All right, so some of the muscles that we're going to discuss about here on the anterior thigh are going to be, all right, one of our strongest hip flexors is iliopsoas. So iliopsoas is an interesting muscle because, right, in the pelvic cavity and the abdominal cavity, right, iliopsoas was once 2 separate muscles. It was psoas major and iliacus. But once it runs underneath the inguinal ligament there, it then becomes the iliopsoas, and it attaches onto, all right, the lesser trochanter of your femur. All right, so it's a hip flexor. It is the most powerful hip flexor. So you're bringing your knee up to your chest. This one does quite a bit. Now let's go to the lateral portion of your thigh. This is your coffee drinking muscle, the tensor fasciae latae muscle. Distally, it attaches onto the iliotibial tract. That's that non-contractile, non-muscle tissue. It's a dense connective tissue. Tensor fasciae latae attaches onto that. So this muscle is going to abduct the leg, the thigh. That means it's going to pull it away out to the side, and it's going to medially rotate. That means basically turning your foot in. If your leg is straight, if I tell you to turn your toes in, all right, that is going to be medial rotation of the thigh. All right, the muscles of the medial compartment. If you notice, a lot of them have a similar name in front of them. Adductor. So Adductor Longus, Adductor Brevis, Gracilis, and Pectineus will all do adduction of the thigh and flexion of the thigh. Whereas Adductor Magnus, yes, it does adduct the thigh, but because it is in the medial compartment, but it's more towards the posterior portion of the medial compartment, it's going to extend and laterally rotate the thigh. Lateral rotation, if your leg is straight, I'll tell you, hey, turn your knee and your toes out. And that will be lateral rotation of the thigh. Another muscle that you don't have to know for identification purposes, but you should still know, is obturator externus. Externus tells you the movement that this muscle is going to do. It also is going to externally rotate or laterally rotate the thigh. So here you can see a couple of those muscles that we were talking about. We'll go through all these, all right? So here's Psoas Major. Now on top of Psoas Major is Psoas Minor. Again, I'm not going to worry about that for here, but here's Psoas Major, iliacus. They combine together, and see, normally the inguinal ligament would be right here. So once these muscles come out inferior to the inguinal ligament, they're known as iliopsoas, and it attaches onto the medial portion of the femur there, the lesser trochanter. Here we can see here's Pectineus, Adductor Brevis, Adductor Longus, and again, they're all on the medial portion there of the femur, so they're going to create adduction. If you notice, Adductor Magnus is further away, more towards the posterior portion, so it will cause extension and it will cause lateral rotation. All right, some more of the muscles here of the posterior compartment of the thigh, gluteus muscles, the Gluteus Maximus, Gluteus Medius, and Gluteus Minimus. Obviously, Gluteus Maximus is the biggest one. So when you're going to wind up to kick a ball and you bring your leg as far back as possible, this is the muscle that is going to do the lion's share of the work when it comes to extension of the thigh. Good way to tell if this muscle is compromised, if someone complains about having difficulty walking upstairs, and if they say, I just can't get the power to walk upstairs, you should be thinking gluteus maximus. All right, so that's going to be the main extensor of the thigh. It'll also cause some lateral rotation of the thigh. It'll help to, if your leg is straight, turn your toes out. Gluteus medius and gluteus minimus, again, are smaller than gluteus maximus. They'll be deep to gluteus maximus. They both do the same thing. They're going to abduct, and they're going to medially rotate the thigh. They're going to turn your foot inwards. So let's go a little bit inferior to the gluteal region on your thigh and go down to the hamstrings. Hamstrings are three muscles: biceps femoris, semimembranosus, and semitendinosus. The biceps femoris muscle is the more lateral muscle. Right. Easy to remember, all of these muscles here will extend the thigh. So again, when you go back to kick a soccer ball or whatever, okay, when you're winding up and bring your leg back, your hamstrings muscles are also going to contribute to that, but they are a big knee flexor. So when you go to bend your knee, you are contracting your hamstrings muscles. Now, some of these other muscles listed below, you don't have to know all of them except for piriformis for identification purposes, but you should be familiar with these muscles. Piriformis, I call them the gemelli brothers, superior and inferior gemellus. In between those two muscles, we have the obturator internus, and then we've got a square-shaped muscle called the quadratus femoris. All of those will laterally rotate the thigh. So here you can see, here's the tensor fasciae latae muscle in the lateral portion, and it's attaching onto the iliotibial tract. That will help to abduct the thigh and immediately rotate it. On the back side here, okay, here's gluteus maximus. Right, that's the chief extensor, the major extensor of you bringing your leg back. You're going to kick something. And then you can see just above that is the Gluteus Medius muscle. It's going to help with abduction. All right. And then I'm not going to worry about these muscles. You don't have to worry about those. All right, let's move on to the anterior compartment of the thigh, your quadriceps muscles. Quadriceps is 4. So these muscles basically have 4 heads. You have the rectus femoris, the vastus lateralis, vastus medialis, and then deep to those muscles is vastus intermedius. All right. Their job is going to be to straighten your leg out, knee extension. So all these muscles will have a common tendon called the quadriceps tendon, which will eventually become the patellar ligament once we get the patella involved. Another muscle in the anterior compartment is Sartorius. That's that long strap-like muscle that you may have seen. It is the longest muscle in the body. This is the muscle. I tell folks when you make the figure 4 position, all right, that's when you bend your knee and you flex your hip and then you just turn your knee out and you make your leg look like both your legs look like the figure 4. Okay, the one leg that's straight will be the up and down position of the numeral, and then your bent leg will be the bending part. So one leg will be this, and then the other leg that you bend will give this. All right, and so that's what we're talking about. Sartorius, it's going to flex, all right, your thigh, laterally rotate, basically turn your knee outwards, and then it'll also flex and medially rotate the leg. Sartorius does a lot. All right, so you can see here are all the quadriceps down here, all these guys, and then you've got vastus intermedius that's deep to all that, and then here's Sartorius. It crosses from the lateral portion to the medial side of your knee. It's a big, long muscle. Here you can see all the individual quadriceps muscles here and the Sartorius muscle on their own. All right, how about if we move down into the leg now? So we're going to now talk about the muscles that are going to manipulate or move the knee joint, the leg. So you have gracilis, and we talked about that. That was in the medial compartment of the thigh, but it does play a role in flexion of the leg because it does cross the knee there. So it will flex the leg when we're talking about the knee joint there. We already know that it adducts the thigh because it's found in the medial compartment there. Going back to the posterior compartment of the thigh, we have our hamstrings muscles. Now we know that the hamstring muscles are going to extend the thigh when you go back to kick the ball. But what's it going to do to your knee? It's going to bend your knee. So it will flex the leg. Now, when we flex the leg, we'll get some lateral rotation of the leg. Whereas that's the biceps femoris. When we're talking about the semimembranosus and semitendinosus, when we flex our leg, we'll get medial rotation. And the reason why is biceps femoris is lateral on your thigh. It attaches to the lateral portion of your knee. Biceps membranosus semimembranosus and semitendinosus, they're going to be on the medial portion of your thigh, but they will attach onto the inside of your knee. So that's why they'll medial rotate the leg there. So here you can see, here's biceps femoris. Right, it's got 2 heads, short and a long, like we saw in the biceps brachii muscle up in your arm. And you can see how this is the lateral portion of your leg and this is the medial side. So your semimembranosus and semitendinosus will attach onto the inside of your knee, whereas the biceps femoris, those tendons will attach to the outside of your knee. Here you can see all of those individual there. All right. So there's a name here that's in bold, and that is crural muscles. Okay, crural is another name for the area down by your calf. All right, so these muscles are going to be responsible for moving your ankle, your foot, and your toes. So we have 3 compartments when we're down in your leg. Okay, that's going to be pretty much from the knee down to the ankle. That's the leg, but those muscles there, all right, we refer to as the crural muscles. So we have 3 compartments: anterior, lateral, and posterior. All right, so when we're talking about the anterior compartment, some of these muscles are going to give you shin splints. All right, well, extensor digitorum longus and tibialis anterior are 2 of those muscles that are going to cause you shin splints. So extensor digitorum longus, this muscle is going to dorsiflex the foot, and it's going to extend toes 2 through 5. So when we're talking about extension, basically your foot is flat and you're going to try to raise your toes up to the ceiling. That's extension. Dorsiflexion is going to be when you try to bring the top of your foot as close to your shin as possible. That is dorsiflexion. So this muscle, extensor digitorum longus, will dorsiflex the foot and extend the toes. Extensor hallucis longus, hallucis refers to your big toe. So it'll do the same thing to the foot. It'll dorsiflex the foot and it'll extend the big toe, your first digit, the great toe. Hallux. All right, fibularis tertius, again, it will dorsiflex the foot, and because it's located more towards the lateral portion of your leg, it will evert the foot. It's not a very strong everter, but it will evert the foot. That's basically turning the sole of your foot out away from your midline. And then tibialis anterior, this is the one that does most of the heavy lifting when it comes to dorsiflexion of the foot, but it does a lot to invert the foot, turning your foot in. The sole of your foot will turn in towards your other foot. That is inversion. Now, don't forget about this structure at the bottom here called the extensor retinaculum. We talked about retinaculum in the upper extremity, and it's just a connective tissue. It's this thickening of the fascia that is going to hold the tendons, right? Because the muscle belly of a lot of these muscles are going to be in the leg, but yet their tendons are going to go out to your digits, your toes. But if you look down at your foot, you can't see these tendons very well. And the reason is because the extensor retinaculum, right, by the ankle will hold those tendons close to the bone, right? So they're not kind of webbing out off of your body. Here's that extensor retinaculum, and you can see what I'm talking about. So the muscle bellies are up here in your leg, and the tendons go underneath the flexor retinaculum, and some of them will go out to the digits here. And so that flexor retinaculum holds those tendons close to the bone there. It's kind of a cool thing. All right, so again, this is just showing you some of those anterior leg muscles. Anterior tibialis, extensor digitorum longus. You can see that those tendons are going out to the distal phalanges there. And then extensor hallucis longus, same thing. Its tendon is going out to the distal phalange here of your great toe. All right, the lateral compartment. Only got 2 out there. Okay, these muscles, because they're on the lateral compartment, are going to turn your foot outwards. They're going to evert the foot. All right, they will help with some plantar flexion, right? But they are weak plantar flexors. We got some better plantar flexors. We'll talk about that in a second. So fibularis longus or fibularis brevis, also known as Peroneus longus and Peroneus brevis. When we go through the labeling, I will show you the different terms that you can use. All right, so longus is going to, again, evert the foot, all right, and then they both will, all right, but what I tell folks is longus is going to be closer to the knee joint, brevis you can see closer to the ankle joint. All right, so here is your lateral compartment here. All right, so here's Fibularis Longus, and then Fibularis Brevis. Again, like I said, it's closer to the ankle joint down in here. There you go, you can see both. All right, now let's talk about the muscles of the posterior compartment. Okay, we have a superficial layer and a deep layer. Okay, so our superficial layer, the most popular one is gastrocnemius. This is the muscle, like when you look at somebody and you see their calf muscles and you're like, dang, they got really well-defined calf muscles. You're looking at the gastrocnemius. This is the most superficial muscle here. All right, so it flexes the leg. What does that mean? If it flexes the leg, that you're going to bend the knee. And it's because gastrocnemius crosses over the knee joint there. It has two bellies. One goes on the inside of the knee, the other one goes on the outside of the knee. But it does a lot for plantar flexion. What is that? If I ask you to get up on your toes, you are plantar flexing your foot. Gastrocnemius is the more explosive muscle. So if you do a lot of jumping, explosive movements, right, you're going to be using your gastrocnemius muscle quite a bit. Now for day-to-day, like walking around, you're going to use soleus. This muscle is deep to gastrocnemius. All right. It also will plantar flex the foot. It won't be as well defined, all right, because it's a smaller muscle. So when we take gastrocnemius and we take soleus and we combine them together and attach them to your Achilles tendon, or what we call the calcaneal tendon, we call that whole conglomeration the triceps surae. The triceps surae. So when you hear someone say the triceps surae, they're talking about both the gastrocnemius and the soleus muscle, right, attaching onto the calcaneal tendon there. All right, plantaris, you don't need to worry about that. All right, our deeper layer. Okay, so we peel back gastrocnemius, we peel back soleus. Behind that, we'll see flexor digitorum longus, hallucis, flexor hallucis longus, tibialis posterior, and popliteus. All right, flexor digitorum longus will flex the foot, and because it attaches, remember, flexion of your toes is curling of the toes. If your feet are flat and you're just trying to, you're on some carpet and you're just kind of trying to grab the carpet, or if you've ever, I do this all the time. If I drop something in the bathroom, like a shirt, and I don't feel like bending over to pick it off the floor, I'll grab, and if I'm not wearing shoes, I'll use my toes to pick something up. That's the flexor hallucis longus. It's going to flex the toes, which will be anything, all the joints that are proximal to its distal attachment site. It will distally attach onto the distal phalanges of digits 2 through 5. So it'll cause flexion of the distal interphalangeal joints, the proximal interphalangeal joints, and the metatarsal phalangeal joints. Flexor hallucis longus, easy. Flexes the foot and it flexes the great toe. Tibialis posterior, plantar flex, and because it attaches onto the medial side of your foot, it inverts the foot, turns your foot inwards. Popliteus is a kind of a cool muscle because it's a small muscle that helps to kind of lock the knee in. And it's located in the posterior portion of your knee there. It's going to cause some flexion of the leg, but here's where it helps out. It will medially rotate the tibia, which kind of is like a corkscrew kind of mechanism that turns that muscle in. So here you can see, where are you? There's popliteus. Right there. And you can see, all right, on the back side of the knee, when it contracts, it'll medially rotate and it will turn your feet inwards, like so. All right, deep posterior leg muscles, good, good, good. All right, let's finish up and get into the intrinsic muscles of the foot. right, think of these muscles as your arch support muscles, and they're going to move your toes. You have 3 arches. Don't worry, I'm not going to ask you to name them. All right. Arch support has to do with muscle, but it also has to do with soft tissues like the ligaments that hold those bones together, those tarsal bones. All right, so our dorsal group, when we're speaking of the dorsal positioning of the lower extremity of the foot, we are referring to the top. Dorsal fin is on the top of the shark, okay? Dorsal group is going to be on top of your foot. So you have the extensor hallucis brevis, extensor digitorum brevis. Now we saw the longest muscles up in the leg. So extensor hallucis brevis is going to be in the foot. So it's going to extend, like the name suggests, the metatarsal phalangeal joint of your big toe. Extensor digitorum brevis is going to extend the metatarsal phalangeal and the proximal interphalangeal joints of toes. Here's the kicker, 2 through 4. Okay, we're not including 5. All right, we got something for that. All right, so when we're talking about our plantar group, all right, this is when we're getting a little bit deeper here. And of course, if we're getting down into the deep fascia, our aponeurosis, all right, this is where we're going to see, all right, sometimes folks will complain of plantar fasciitis, all right, that's because they're complaining of the plantar fascia, but these muscles are going to be in close proximation. Now, again, I'm not going to go through all these layers here with you, all right, but understand we have 4 layers, all right, we go from superficial to deep. So layer 1 is going to be superficial, and then our interossei, layer 4, are going to be the deep ones. I'm not going to go through all this with you here, okay, because we just don't have the time. But you can see here with layer 1, you'll have flexor digitorum brevis. All right, we also have our abductor digiti minimi. Right, but we can see our plantar aponeurosis we've cut away. That's the structure that gives us our plantar fasciitis. All right, and then we get to the real deep muscles. Right, we saw interossei muscles before in the hands. All right, these are the muscles that are going to help with abduction and adduction of your toes there. All righty. Let's go ahead and quickly do some labeling. If you have your atlas nearby, I suggest you get it out and let's do a little bit of labeling on this. All right, psoas major muscle. We talked about that when we were talking about the axial muscles here. This is the muscle that is going to be found in the lumbar spine. It moves inferiorly, and it is going to join up with iliacus. Let me show you psoas major on another model. Here you can see it a little bit better where we're now in the lumbar spine region here. You can see we're inferior to rib 12. So psoas major muscle is going to team up with this fella, iliacus. Iliacus resides in the iliac fossa. You can see it over here on this model. And it's going to be these 2 muscles that are going to collectively kind of join together and form our iliopsoas muscle. All right, so iliopsoas muscle, here's the inguinal ligament, this white tissue right here. This is the anterior superior iliac spine. And we're going down here to one of our pubic tubercles, right? But we're seeing it emerge inferior to that. So this is the iliopsoas muscle, and that's going to attach onto the lesser trochanter. All right, let's go to the gluteal region here of the lower extremity. On the back side, the largest muscle here in the gluteal region is the Gluteus Maximus muscle. You're seeing this view from the lateral view here, and I just want to outline, there's Gluteus Maximus, all of that. Its job is, main job, it's the prime extensor of your hip. Here it is on the posterior view on this model. right, Gluteus Maximus. And here it is on this other model. All right, one of the other gluteal muscles is Gluteus Medius. And here you can see Gluteus Medius here. It's a hip abductor. And here it is, a little bit better on this model. You can see it. Gluteus Medius is deep to Gluteus Maximus. All right, here you can see it one more time on a different model. So there's Gluteus Medius. All right, right inferior to Gluteus Medius is Piriformis Muscle. Now, that yellow thing that is hanging out below the Piriformis Muscle, that's your sciatic nerve. That's the longest, largest nerve in your body. So you can see the Piriformis Muscle is in close proximity to that. In a small percentage of the population, I can't remember it's 1 or 3%, but regardless, right, sometimes the sciatic nerve will pierce right through the muscle belly. So if you get a muscle spasm with that muscle, it can press on the sciatic nerve and you can get sciatica-like symptoms. Here you can see the Piriformis Muscle. I always look for the sciatic nerve, and if I see that the muscle is close to the sciatic nerve or if it's right next to it adjacent, then I know it's Piriformis. All right, on the lateral portion of your thigh, this is not a muscle because it's white. Okay, this is the iliotibial tract. That is connective tissue. It is not muscle. There's the coffee drinking muscle, the tensor fasciae latae muscle, which will attach to the iliotibial tract. Okay, the tensor fasciae latae muscle, right, is right there on the anterior lateral portion of your thigh. All right, now we're looking at the anterior view of your thigh. Just to let you know, you can see these structures. You're not responsible to label those. All right, but I just want to point them out to you. All right, what you're looking at is a vein, an artery, and a nerve. All right, blue is vein, red is an artery, and the yellow is a nerve. We call that the van, the femoral van, which stands for femoral vein, femoral artery, femoral nerve. And we say van because we go from medial to lateral. V for vein, A for artery, N for nerve. Okay, so the femoral van. I can't draw. I use that as an anatomical landmark because the arrow is pointing to a structure that's medial to it. How do I know that's medial, Dr. Kaz? Well, look, I gave you another model here all the way to the left, right? Where the big toe is down here, that is medial. The pinky toe is lateral. So this muscle is here on the medial portion of the van. That's pectineus. Pectineus. That's this fellow right here. All right, just inferior to that is going to be Adductor Longus. Adductor Longus. Now we're looking at a medial view of the thigh. Again, I know it's medial because I can see the big toe down here. All right, so this is the medial view of the thigh. Here's Adductor Longus on the medial view. This is anterior. This is posterior. So the Adductor Longus is more anterior out of the medial compartment muscles. Okay, we're going to skip this muscle and we're going to just go right to the back here. We're going to come back to that muscle. There's the Adductor Magnus muscle. more posterior in the medial compartment there. So there's a muscle that sits between the Adductor Magnus muscle and the Adductor Longus muscle. That's the one we just skipped. That's this fella right here called the gracilis muscle. Gracilis. All right, and now back to the anterior compartment. Remember the longest muscle in the body? This is Sartorius. Sartorius is going to connect onto the anterior superior iliac spine. It's going to cross over in front of your thigh and run down the inside of your thigh. And it'll attach onto the medial side of your knee. So here you can see it on the anterior view. Here you can really see it in full length view of the on the lateral view of the Sartorius. Big, long, strap-like muscle helps you to make that figure 4 position with your knee. Okay, now let's get into the quadriceps muscle of your thigh. Okay, so the most anterior muscle of your quadriceps muscle group is called the rectus femoris. This is the one that's right in the center of your thigh. Rectus femoris. So we can see it here on the medial view. I'm going to show it to you from a couple different views. Here's the medial view. It's the most anterior muscle on the front of your thigh. Here it is on the anterior view. It's front and center, right in the middle there. That's the rectus femoris muscle. All right, and here you can see it from the lateral view, rectus femoris muscle. It's just this right here. Everything to the left of that red line that I drew is the rectus femoris muscle. All right, now back to the medial view of your thigh. The muscle that you can predominantly see is the vastus medialis muscle. Again, this is another muscle of the quadriceps muscle group. This is that muscle that sits on the inside of your knee. Here you can see it on the anterior view here. Here's the vastus medialis muscle. Now, we've dissected away the rectus femoris muscle from here, okay? So you're going to see it. I'm going to bring it back here. Here, now the rectus femoris muscle is back, but we're still indicating the arrow at vastus medialis. On the lateral part of your knee, you have the vastus lateralis muscle. All right, we don't have rectus femoris. We moved it away. Let's bring it back. There it is. There's rectus femoris, but we're still pointing our arrow to the vastus lateralis muscle. And if you notice, when we're looking here at the lateral view, the vastus lateralis muscle is going to be that muscle that's anterior to our iliotibial tract. So it's going to be in between the white there and that red line that I drew. Vastus lateralis muscle. And then there is vastus intermedius. So we get rid of rectus femoris, and vastus intermedius lies deep to that. All right, on to the posterior compartment of the thigh. Hamstrings. We have 3 hamstrings. The most lateral is the biceps femoris. It has 2 heads, a short and a long. All right, so the most lateral is the biceps femoris muscle. Now we're going to move more medial. All right, well, oops, let me show you the biceps femoris from the lateral view. Now we have our semitendinosus muscle. So it's hard to see because part of the semitendinosus muscle sits on top of semimembranosus. So I'm just going to kind of outline the semitendinosus muscle here. So in between those red lines there, that is the semitendinosus muscle. Now we're just using one arrow to identify that. All right, the muscle that is lying underneath there, distally on the knee, that's the semimembranosus muscle. So you can see we're using 2 arrows to identify the semimembranosus muscle. And again, these muscles of the hamstrings, they're going to bend the knee and they're going to help extend the thigh. Getting down now into the crural muscles, we're down into the leg now. All right, posterior compartment, there's the gastrocnemius muscle. It's got 2 heads, lateral and medial head, and they attach onto the femur, so they will flex the knee. There's the calcaneal tendon, also known as the Achilles tendon. And soleus is deep to the gastrocnemius muscle. Soleus and gastrocnemius form the triceps surae, right? You can see how they're attaching onto the calcaneal tendon there. Here you can see soleus, just deep to the gastrocnemius. All right, now don't forget, we have 3 compartments here in the leg. We have a posterior, an anterior, and a lateral. So let's look at the lateral. There's only 2 muscles, and I mentioned this before, all right? In our lecture notes here, we were talking about Fibularis Longus, but you can also call it Peroneus Longus also, okay? The Fibularis Longus, it's tough to see, all right, but it is going to be closer to the knee joint. Then it's got its tendon that comes all the way down here. All right, so there's Fibularis Longus. Then Fibularis Brevis, its muscle is going to be closer to the ankle. So Fibularis Brevis or Peroneus Brevis. Okay. On to the anterior compartment. You have the Tibialis Anterior muscle or anterior tibialis. That's right against your shin there of the tibia. So it's pretty medial. This muscle helps to extend the toes. Also, it helps to dorsiflex your foot, but invert your foot. Did I say toes? Scratch that. Tibialis anterior has nothing to do with the toes. I don't know why I said that. All right, it helps to invert the foot, and it helps to dorsiflex the ankle there. I don't know where I was getting the toes from. Onto the posterior compartment, we've got the tibialis posterior or posterior tibialis. And you can see Flexor Digitorum Longus. And then back to the anterior compartment, we've got Extensor Digitorum Longus. And then last but not least, the patellar ligaments, right? Also known as the quadriceps tendon. All right, folks, that concludes the lower extremities. You are now fully armed